Hello, everyone, and thanks for joining today's Town Hall. I'm Leor Tall, Campaign Director at Unrig Our Economy. Republicans in Congress promised to lower costs, but instead they cut our healthcare and are making life more expensive for working families. They voted to cut Medicaid and enhance ACA tax credits and put hospitals and community health centers at risk, all while protecting tax breaks for billionaires and big corporations. The result is higher premiums, less access to care, and more families being forced to choose between paying for their health insurance and paying for their basic needs. And now Republicans in Congress want to cut healthcare even more to pay for their unnecessary and expensive war, which is already driving up costs for working families, like with gas. That's why we've launched Stop Taking Our Healthcare, which is a nationwide campaign fighting back against Republican efforts to rip away healthcare coverage from working families when they need it the most. We're encouraging everyone to visit stoptakingourhealthcare.com to learn more about the campaign and to continue speaking out and telling Republicans to stop attacking the healthcare coverage that we rely on. So today, for the town hall, we'll be hearing from several speakers, including Congressman Joe Morelle, Tiffany Mason from New York, Congresswoman Debbie Dingell, Congresswoman Adelita Grijalva, Audrey Horn in Nebraska, and closing us out will be Congressman Brendan Boyle. Kicking us off with our lineup of speakers is Congressman Joe Morelle, who is proudly representing New York's 25th Congressional District. He is a lifelong resident of upstate New York, a former small business owner, and throughout his career, Representative Morelle has worked diligently to improve and expand access to healthcare for all people, to grow our economy, protect communities, and fight for working families. So without further ado, I'm very excited to hand it off to you, Congressman Joe Morelle.
Well, thanks, Leora. It's so great to be with all of you. And I want to start by thanking the Hub Project, Unrig Our Economy, and Social Security Works for bringing everyone together. And it's always great to be with my colleagues, Representative Grijalva, Representative Dingell, and Representative Boyle. So I'm in great company. And also with our incredible storytellers who are going to be sharing their thoughts about where we are in this moment and what we can do about it. And I'm really grateful to be a part of the conversation. I was in the New York State Legislature as the chairman of the Insurance Committee when we were implementing at the state level the Affordable Care Act and recognizing how important that was, how difficult that was, but really working so much on making sure everybody had access to affordable quality health care. And I have the great privilege of serving as the vice ranking member of the House Appropriations Committee, where I serve with ranking member Rosa DeLauro from Connecticut. You know, we've just gone through the first 4 bills that will make up the 12 bill set of appropriations to fund our government. And what you can tell is that what Republicans started under the first year of the Trump administration's second term, their reconciliation, which gutted SNAP and took $900 billion away from Medicaid over the next several years, that they're continuing on with that. They're going to continue to fight against quality, affordable health care for all Americans. And interestingly enough, and this is no surprise to many of us, that's going to particularly be felt in rural areas, which will be hit hardest the first. But no one is safe from this. This is not an abstract thing. This is going to literally mean people will be without health insurance because of the subsidies and the tax credits that were cut out of the Affordable Care Act. A lot of working men and women, small business owners who use the Affordable Care Act exchange to be able to get a quality, affordable healthcare product can't any longer. And the interesting thing is, whether you have Medicaid or whether you have private insurance, commercial insurance, once you lose it, doesn't mean you're suddenly healthy. You're going to still get sick. You're going to still, have a kid that gets hurt on the playground, and you're going to end up in emergency rooms. And it is going to continue to overly burden hospitals and healthcare systems. The first 4 bills we've done just show a continuation of the lack of interest Republicans have. And Leor said it well, which is they're prepared to make people sacrifice. American families who are struggling sacrifice with a growing cost of living, an illegal and ill-advised war in Iran, which has now cost us $60 billion. These are Republicans who think we can't afford health care, we can't afford nutrition, we can't afford to bolster Social Security, but we can spend $60 billion in a matter of 5 or 6 weeks on a ill-advised and unauthorized military incursion in Iran. So look, Democrats are going to fight with everything we have. We're going to litigate, we're going to legislate, we're going to educate, we're going to agitate, and we're going to join with people all over this country, because the great thing about America ultimately is the people that have the greatest impact. And the most important title in American democracy isn't president, isn't member of Congress, it's citizen. And citizens are not going to sit still and allow the dismantling of the programs that we hold dear. And I will say this, one final thing, if I can. You know, all politics in some way is local. I lead a project in Rochester to make sure that everyone on Medicaid, everyone who has SNAP benefits, that they meet the new requirements, the federal requirements. I don't want a single person in my community to lose benefits because they didn't fill out the new paperwork burdens. And I think it's interesting. We're asking people who are struggling to do more paperwork, to jump over more hurdles. But we didn't ask a single thing of billionaires when we gave them a tax cut. We didn't ask them to build more factories. We didn't ask them to create any more jobs. They just got the handout, while people who are struggling every day are being asked to do more and more with less and less. So we're going to fight back. I'm, as I said, honored to be with all of you, honored to be with my colleagues. We're going to fight every single day, because budgets and where you spend money are a priority of what you value. And we as Americans value quality health care. We value our children. We value everyone having an opportunity in American life. So thanks again for the opportunity to be with you and for all the great work you do.
Thank you, Congressman. Next up is Congresswoman Debbie Dingell. Congresswoman Dingell's activism took root in her passion for issues important to women and children. She successfully fought to have women included in federally funded health research and advocated for greater awareness of issues directly related to women's health. Serving in the House since 2015, the Congresswoman is now the chair of the Democratic Policy and Communications Committee, where she is tasked with making sure that House Democrats stand in sharp contrast with the policies that we have been talking about from House Republicans. So with that said, we are so grateful to have you join us, Congresswoman, and the floor is yours.
Thank you, Leor. And first of all, I want to say thank you to all the groups that are supporting the Stop Taking Our Healthcare campaign, and just guaranteeing that this is going to be across the country and that we are making sure voices are being heard. And Joe just named all my colleagues, and I'm not going to repeat them, but I cannot tell you how honored I am to be with all of them in this fight. And it's a fight that deeply matters. Because look, across this country, people are feeling the continued attacks on their health care. When I started worrying about women not being included, people thought that their health care would be there, they'd have access to it. And it's gotten much worse. I'm hearing every single day from parents that are trying to keep up with rising costs, from seniors who are worried about that they're going to lose the coverage that they depend on, and is Medicare going to be there for them, and what's happened to Medicaid, and to workers who are just one illness away from financial ruin. And they're not isolated stories. They're the direct result of policy choices that have been made worse in the last year and have aggravated and cost millions of Americans their health insurance, and millions of Americans aren't going to the doctor because they don't think that they can afford it. They're not getting their medicine. They're not getting their medicine. And I want to say that these are choices that make care that the others have made. I won't be partisan. I will be, but that are making care more expensive, less accessible, and less secure. And that when those choices are made, who gets hurt? Working families are bearing the burden. A lot of these cuts have been so billionaires can get tax cuts, but people can't go to the doctor when they need to go to the doctor. And that's why the Stop Taking Our Healthcare campaign matters. It's about accountability. It's about making sure that people understand what's at stake and that they make sure their voices are heard and they hold people accountable. Because when people speak up and share their stories, when they demand better, it makes a difference. And when they put the human face on who is being hurt and the decisions that are being made, and how, quite frankly, people are dying because of decisions that have been made, it forces a conversation. And at the end of this day, this comes down to a simple question. Who were we fighting for? So I'm going to tell you who I'm fighting for. We're fighting for families who want the security of knowing that they can just go to the doctor. I was at University of Michigan to see my doctor and stepped on the elevator, and a mother with a little boy in a wheelchair just started sobbing and said to me, please promise that I'm going to be able to still bring my child here, that he's not going to die because I can't get health care. I made that mother a promise that day she would be, and called the head of the hospital and said, you cannot not take care of this little boy. My stepfather died this week, and I spent most of last weekend in a memory care with him, my mother, and a child came, not a child, a grown woman came in whose parent was on the floor and said, I can't keep paying for this. I don't know who's going to take care of my father. Our family can't afford it. We're running out. Medicaid's been cut. I mean, these are really real people's lives. And I went to the pharmacy, and a man recognized who I was, and he showed me how expensive his medicine was, how he really didn't know how he was going to pay his bills. And then he said, and half the time I can't get the medicine either. It's the only thing keeping me alive. I'll tell you something. In the richest nation on earth, we need to be having a higher standard than this. This is the work that's before us. It's the fight that we're in, and I'm not going to stop fighting. And all of us together have to make our voices heard. We have to demand accountability. And I'm fortunate to have all the groups that are working across the country and my colleagues. We are all allies and champions. We're in this together, and together we got to get it done. Thank you.
You said it so clearly. This is real people's lives. Thank you for joining us, Congresswoman, and for fighting for families every single day. Your stories really remind me why we are in this fight and who exactly we're fighting for. So thank you for all your work on this. Tiffany Mason is our next speaker. Tiffany lives in New York 17, represented by Congressman Mike Lawler. She relies on Medicaid, which is a program that Congressman Lawler voted to cut last year in the Republican tax law. Tiffany, take it away and share your story.
Good afternoon. Thank you for having me. My name is Tiffany Mason. I live in Rockland County, New York. I have cerebral palsy, but it doesn't stop me from living my life. I work part-time, I volunteer, and I'm out in my community every day. Medicaid makes that possible. It pays for the care I need to live independently, to work, and to give back. Without it, my life would look different. That's why Republican healthcare cuts are so personal to me. When Republicans in Congress cut Medicaid, they didn't just cut a line in the budget. They cut the care that helps people like me live independently. They cut the support that helps people stay in their homes. They cut the services that let people like me work, volunteer, and be part of our communities. Medicaid paid for the cost of my wheelchair. My wheelchair is my legs. It's how I get around. Congressional Republicans' vote puts that in jeopardy and potentially stops people from receiving durable medical equipment that they need. It isn't just about me. I'm not the only one that's impacted. Hundreds of thousands of New Yorkers could lose health care and the equipment they need to survive because of these cuts. Families will face higher costs, people will lose coverage, and care will get harder to access. All so that billionaires can get another tax break. We need access to healthcare, and we need Republicans in Congress to lower cuts. Costs are getting higher. The prices of gas and groceries are rising, and it takes away from our care and our independence. We're not asking for special treatment. We're just asking for the things that make our lives possible. Republicans in Congress need to stop cutting healthcare and start lowering costs for working families. They need to protect Medicaid, and they need to protect people with disabilities. They need to protect the care that allows us to live with dignity and independence. Thank you.
Thank you so much, Tiffany. Congressman Adelita Grijalva is a lifelong public servant, advocate, and resident of Tucson, Arizona, with a long history of public service. Prior to her election to Congress, she was sworn into the U.S. House of Representatives last year in 2025 and made history as the first Latina from Arizona elected to Congress, and setting the record for the longest wait to be sworn in after a special election. Crazy to watch. Congresswoman, the floor is now yours.
Thank you. Buenas tardes. Hi, everyone. I'm honored to be here with you today. Thank you to the entire team for organizing this event, and it's an honor to be here with my colleagues. Most importantly, I want to thank Tiffany and Audrey for bravely sharing your story, your life with us right now. In this time where we have these kinds of cuts that our people don't understand if they're not living through them, it's so important to hear the stories of people that are dealing with this real life situation every single day. It's an honor to stand with you. We're here today for a very simple reason. Healthcare is a human right. It's not a privilege reserved for billionaires. So let's talk about what's currently happening. Republicans and Donald Trump has slashed over $1 trillion from Medicaid and the Affordable Care Act. Why? To bankroll tax breaks for ultra wealthy and major corporations. They are literally trading the health of our neighbors for profits of a few. Medicaid is the largest health insurance provider in this country, covering 68 million Americans. Here in Arizona, it is a lifeline for more than 1.5 million people. These are our children, our seniors in nursing homes, and families who work multiple jobs just to keep the lights on. Republicans pretend to be anti-bureaucracy, yet they pass laws that are designed to bury Arizonans and everyone in red tape and prevent them from getting their Medicaid coverage. This will cause an estimated 194,000 Arizonans to lose healthcare coverage. And by allowing ACA premium tax credits to expire, Republicans chose to drive up healthcare costs while groceries, gas, rent, utilities are already hurting the American people because they continue to go up. In fact, around 70,000 Arizonans already lost healthcare coverage because Republicans refused to extend the Affordable Care Act premium assistance. And some estimates show that 1 million Latinos nationwide are at risk of losing their health insurance due to the end of tax credits. This isn't just about insurance coverage. It's about the very infrastructure of our state. When you gut Medicaid, you gut our hospitals. In our rural communities in my district, places like Nogales and Bisbee, this is a matter of survival. Rural hospitals rely on Medicaid to keep their doors open. These cuts don't save money. They just shift the cost. Instead of preventative care, people are going to wait to get that needed appointment and end up overburdening emergency rooms in total crisis, raising insurance premiums for all of us to cover that cost. It's more expensive, it's less effective, and it's heartless. To politicians who put billionaires over people, we need to remember who we're fighting for. To the families, we see you. To those of you who claim there isn't enough money for healthcare while spending billions on endless wars and corporate giveaways, we don't believe you. Our message today is simple. Hands off Medicaid, hands off Medicare, hands off affordable healthcare. I am committed to fighting every single day in Congress to restore this funding and protect the ACA. We must ensure that every Arizonan, every person in every single one of our communities nationwide, no matter their zip code or their income has access to the healthcare they need. Thank you, and I'll turn it back over to you.
Thank you, Congresswoman. You're an inspiration to many of us on this call and those who are tuning in. So we are incredibly grateful that you can join us today and for all of your work fighting for working families in Arizona and across the country. Thank you again.
Thank you.
Next up is Audrey Horn. Audrey is tuning in today from Omaha, Nebraska, and is going to share her experience with having to deal with high healthcare costs. So Audrey, take it away.
All right. Hi, my name, like she said, is Audrey. I'm a retiree here in Omaha, Nebraska. My husband and I get our health insurance through the Affordable Care. I retired several years ago. One of my daughters and 3 children rely on Medicaid, and my husband has pre-existing conditions, so we definitely need insurance. Our family knows what it's like to struggle to find health and afford health care. That's why these programs matter so much to us. Republicans in Congress still voted to cut health care on families like mine. They promised low costs. Instead, they voted largest cuts to Medicaid and made the Affordable Care Act more expensive. They cut those enhanced tax credits. This means higher costs for families like mine. The bronze plan, by the way, lowest level plan you can have, I have, went up $688 for 2026 per month, $688 per month. And a lot of families are seeing their costs double, triple, quadruple from what their premiums were last year. And for my family, this isn't political, this is personal. Republican cuts impact whether my husband can get the health care he needs for his pre-existing conditions. And Republican cuts affect whether my stepdaughter and her 3 kids can go to the doctor. They also affect whether families in my community can afford to be covered at all. Families just help. We're not expecting a ride, not at all. But you can't expect a regular middle-class couple to pay $2,433.27 a month for a premium for a bronze plan. That is our premium for just 2 people. And while working families are already struggling with higher costs on everything, Republicans in Congress are making it harder to see a doctor, fill or pay for health coverage. As to Medicaid, are threatening to close our hospitals and local health centers. And actually in Nebraska, that has happened. That is not a maybe. That has happened in our state. Also, billionaires and big corporations can get another tax break. And now Republicans want to cut healthcare even more to pay for an unnecessary war that is already making life for everyone more expensive. This isn't what families need. We need lower costs, we need affordable care, and we need leaders in Washington who protect our healthcare instead of cutting it. In Nebraska, we look out for each other. We believe people should be able to get the care they need. But Republicans in Congress are choosing billionaires over working families. And families like mine are paying the price. Thank you so much for your time. I appreciate everyone that's doing everything they can. Unfortunately, I can't count on my elected officials at this current time to listen to these stories, although I have told them many times. So thank you very much.
You're right, Audrey. $2,000 in premiums is not what families need. Families need lower costs, not $2,000 bills or tax breaks for billionaires. Audrey, thank you so much for sharing your story with us and being willing to talk about the high costs and the high premiums and your experiences in Nebraska. They're not unique, and we've heard it from thousands of people across the country who are facing similar issues thanks to the votes that their representatives are taking in Congress. Our last speaker for the day is Congressman Brendan Boyle. The congressman was born and raised in the city of Philadelphia. The son of an immigrant, Congressman Boyle's father was a janitor for SEPTA, and his mother was a school crossing guard. He was the first in his family to attend college, graduated from Harvard University's John F. Kennedy School of Government with a master's degree in public policy, and is now in his 6th term in Congress. And is the ranking member of the House Budget Committee. Congressman, thank you so much for joining us today.
Well, thank you, Leor, and everyone with Unrig Our Economy. I also want to thank Social Security Works, the Economy Security Project, and really everyone who helped behind the scenes on this call and to lead this campaign. It's a challenge sometimes to go last because we've heard a lot, right? So I want to, if I can, attempt to summarize some of this. But first, before I do, let me just say, in addition to listening to my colleagues, who are all wonderful, incredibly talented and hardworking and principled people, it was especially profound to hear the lived experiences of the two folks who spoke before me, and I especially want to thank them. So, in conclusion, where are we at this moment in the fight to save our healthcare? Well, thanks to Reconciliation 1.0, which was passed last summer and signed most shamefully by our president on the 4th of July, 15 million Americans are about to lose their healthcare coverage. By the way, that's not my figure. That's not the figure of any progressive group. That's the official estimate from the Congressional Budget Office, or CBO. Now, the bill was passed last summer, but the actual healthcare cuts, the overwhelming majority of them, are scheduled to take effect beginning this year. That was done on purpose because the Republicans who designed this bill, at the direction of the president, wanted to put some time and space between the bill passing and the devastation taking effect, so they hoped they would escape the blame. Yesterday, I traveled a couple hours to my state's capital, Harrisburg, Pennsylvania, to stand with a couple state legislators and talk about how many Pennsylvanians will lose their health care coverage as a result of that reconciliation bill. Some 500,000 all told, due to the cuts to Medicaid that will begin in December, as well as the various cuts that were made to the Affordable Care Act, some of which began in January 1st in this year with the expiration of the tax credits, some of which are yet to come. The bottom line is this: millions and millions of people are about to lose their health care, all to subsidize tax breaks for billionaires. Now, I want to say this to those who may not be on Medicaid or may not be on the Affordable Care Act, might be one of the majority of Americans who get their health care from a private employer plan. You might be tempted to think, well, boy, I feel bad for those who are on Medicaid, those in the ACA, but geez, that doesn't impact me. I have private health insurance. I have bad news for you. As study after study has shown, the healthcare costs of every single American family right now is going through the roof. Because the reality is, you cannot take more than $900 billion of healthcare spending from the program, from the overall healthcare system in this country, and expect those costs not to be made up somewhere else. So the cost of our care, all of us, is being impacted, as well as the quality. Finally, let me close with this, because I focused on last year's big reconciliation bill, which seems to be the centerpiece of this president's economic agenda. There is a second reconciliation bill that is going through the Congress right now. Right now, it's in the Senate. Does that have even one dime to go to healthcare? No. Does it have a dime to address any of the other rising costs facing the American people? No. Oh, but it does have $1 billion for Donald Trump's ballroom. After he said repeatedly, no taxpayer money would be needed for such a vanity project. The reality is this White House and its enablers in Congress don't give a damn about American families. They only care about ballrooms and tax breaks for billionaires. Thank you.
Thank you, Congressman Boyle, and thank you to all of our speakers for being here today. Your experience reminds me why this fight matters. So families don't have to make tough decisions between caring for their families and themselves or paying for their other long list of bills. Nobody, and I mean nobody, should have to be put in that situation, especially while Republicans in Congress help the rich get even richer and start these costly wars. So to close us out, I'd like to thank everyone again for joining us on today's call. Your being here today helps us hold President Trump and congressional Republicans accountable for taking away our health care. We were excited to see all of the events we had organized together in the month of April and May, which were more than 40 events nationwide in total. Whether you hosted or attended a Stop Taking Our Healthcare event, or are tuning into this live stream right now, or even if you're making your voice heard in your community day in and day out, your voice matters and your healthcare matters too. So thank you again for fighting for affordable healthcare and reminding Republicans in Congress that they should be lowering costs, not taking away our healthcare or funding this war. Thank you again to our speakers for joining us today, and the fight goes on. Thank you all.